Do your joints ache every time you lift, even as you're getting stronger? It's one of the most frustrating issues for people over 40, and it can make you question whether lifting is even worth it. It is. With my background in sports therapy and 14 years as an international athlete in karate, I've learned to deal with all types of injuries, both my own and those of my clients. So in this video, I'm going to show you why your joints and tendons and ligaments might hurt when you do weight training over 40, and how to fix it so you can keep lifting safely and effectively for years to come. To start, let's look at a myth about heavy lifting. When you use weights that are appropriate for you and have adequate recovery, high-load training is not inherently harmful. Research shows that it can enhance performance in athletes and reduce the risk of injury. But if you have pain, lowering the load that you're using can help you reduce your discomfort. And it's equally effective for muscle building as high-load training. So if you don't feel comfortable doing 5 or 6 reps, do 10 to 12 reps of a lighter weight. You'll still get muscle growth as long as you push yourself close to failure. Good load management can reduce your risk of injury because most joint pain isn't about a single lift. It's about the way you progress through training. And one trap that people fall into is pushing harder and faster than their tissues can handle. Doing too much too soon. Think of your friend or colleague who never runs, then suddenly signs up for a 10K charity race. They start running several times a week, and by week 3, their knees and shins are screaming. It's not because running itself is bad, but they didn't give their muscles, joints, tendons, and ligaments a chance to adapt. Weight training works the same way. Even if you've been training for a long time, if you've taken time off or just reduced your volume for a period of time and then you suddenly increase it, you might experience pain. And muscles adapt much quicker than tendons. Ligaments are even slower. Muscle turnover is faster than collagen turnover. So your muscles might be handling it fine, but your tendons have yet to adapt, especially as we get older, where our tendons tend to be stiffer and less elastic and don't have the blood supply they once did. When you increase training load, your muscles might feel stronger within weeks, but your connective tissues are still lagging far behind. So build up your training volume, the amount of sets and reps you're doing weekly, very gradually. Start with loads you can handle without pain, increase by no more than 10% per week, and give those connective tissues time to adjust. Over 40, our recovery can take longer, so make sure you adapt your expectations as you get older. Once you've adjusted your pace, the next issue can be overdoing certain exercises, particularly overloading compound movements. I talk about compound lifts a lot, how it's better to do more multi-joint movements like deadlifts, rows, dips, and pull-ups, so that you're working more muscle groups at once for better overall muscle development and efficiency. But you do have to be a bit cautious to make sure you're not overloading your capabilities with those movements. I learned this lesson the hard way a couple of weeks ago, even though I should have known better. I'd been doing lots of my favorite upper body compound exercises, incline bench press, chin-ups, dips, and military presses, and I was starting to feel a bit of discomfort in my left shoulder. I had frozen shoulder 3 years ago, and it didn't recover quite 100% mobility from what it was. But it was only a little niggle, and I wanted to shoot myself doing hanging leg raises and knee raises for an abs video I was doing. I started to feel some pain in my shoulder during those exercises. Then, since I had my 11-year-old son available to help me shoot, I thought I'd throw in some chin-ups so I could add that video to my collection. And as I was lowering myself down from the chin-up, I felt a sharp pain and then a dull ache in the shoulder, and I realized I'd strained my sternoclavicular joint. Oops! I think this is actually the part in the video where it happened. Please at least watch that abs video so I can feel like it was all worth it. So now it's no bench pressing, overhead pressing, chin-ups, or dips for at least a few weeks while I try to get this injury rehabbed. There's a couple of lessons in there for you. Compound lifts are powerful, but the total stress adds up faster than isolation exercises like lateral raises, bicep curls, or cable tricep extensions. Don't stack every pressing and pulling movement into the same week without enough recovery. These exercises are more demanding and should be mixed in with some isolation exercises for balance. The other message is not to ignore little niggly pains or discomfort in a particular area. Avoid aggravating exercises for at least a few days to see what's going on. You might just need a bit more recovery time. But even with smart exercise choices and listening to your body, repeating the exact same moves for too long can create problems of its own. so you could have repetitive strain from doing the same exercises. You probably notice how your wrists feel when you spend hours typing on a keyboard. The repetitive movements cause stiffness and pain over time. The same thing happens when you only do a flat barbell bench press or barbell squat for months on end. In general, you want to make changes to your weight training program every 6 to 8 weeks if you're intermediate and have been training for a few years. It doesn't mean completely blowing up your program or skipping bench pressing altogether if that's an exercise you enjoy. Even small changes are enough to help your joints recover. I recently switched to a multi-grip or Swiss bar for my incline bench press because it's a bit easier on the shoulders to have your hands in the neutral grip rather than the standard pronated grip position. That's the type of bench press I'll be starting with to rehab my shoulder. Switching from a flat bench press to an incline or vice versa gives you a slight angle change that hits your muscles differently, which means it usually changes the stress just enough to avoid overdoing that movement. And whatever exercise you're doing, make sure you're doing it properly, because another cause of joint pain can be not being careful with technique. Even if you're experienced with weights, poor technique can still sneak in when fatigue sets in or if you're distracted. Sometimes if you're chasing heavier weights, you can get tempted to add unnecessary motion, which can sometimes cause issues as well. But cranking out a heavy weight with bad technique isn't worth it if it's going to injure you and keep you from training altogether. If you're prone to joint aches, focus on a slower, controlled movement. And while I'm usually pretty big on full range of motion, so you can develop the strength and resilience through the full range of motion of a joint, there are times when it's best to use a slightly shorter range to keep the exercise pain-free. Because sometimes when people focus on full range of motion too much, they actually end up going outside their normal range. Over time, that can lead to inflammation and pain, especially if you have a history of injury in that area, like I do in my shoulder, actually both shoulders. It's a good idea to record some of your lifts and have a knowledgeable coach review your technique. It's one of the things that I offer my online coaching clients if they're not sure they're doing exercises correctly. Small technical tweaks can often help you reduce pain and get you progressing again. But if you're using certain exercises, there may be no way to do them without hurting yourself. It's possible that you're doing exercises that aren't good for you. There are certain exercises that are considered dangerous because they're likely to cause injury in many people. So I'm talking about behind the neck pull downs, upright rows, and deep weighted dips. None of these exercises are inherently harmful, but they require a range of motion and a strength and coordination in that range that most people just don't have. For someone like me with a history of shoulder injuries, doing upright rows or deep dips regularly might not be the best choice. But in a shorter range, they could be totally fine. When making your exercise selections, you should always consider benefit versus risk. Is it really worth it if there's another exercise that can give you the same or similar benefits without the risk? If you're having any pain, have a look at the types of exercises you're using. It might take a coach to point those out if you're not sure which of them can be potentially aggravating. But if you notice pain during the exercise, that's your first sign. If you have tennis elbow or golfer's elbow, for example, and you do a lot of chin-ups, you might want to ease off for a bit to see if that helps your pain. Now, if you've had a look at your training, you're not overdoing the volume, you're changing your exercises and positions regularly enough, and your technique is on point, then there could be other medical issues to rule out. In fact, it might not be your training at all. Sometimes joint pain is less about what you do in the gym and more about what's happening in your body. I had a client in his 50s who complained about knee pain all the time, thinking he was just getting older. He found out that he had a meniscus tear, and with a steroid injection and physical therapy, he finally got rid of his chronic knee pain. A client in her late 40s said her elbows and hands were always sore. It turns out she was experiencing perimenopausal hormonal changes, and her joint pain improved after hormonal therapy. Underlying injuries, hormonal changes, rheumatoid arthritis, osteoarthritis, or even stress fractures can all masquerade as just gym aches. So if pain is persistent, sharp, or worsening, see your doctor. Don't assume it's just training. Get checked for medical issues that could be causing your pain. Ruling these out early means you can adjust training safely and avoid suffering for longer than you need to. You'll stay strong and resilient while lifting. To put together a program to build lean muscle over 40, watch the video here.